Internationally reputable sources identify loneliness amongst elderly populations living in rural communities as a critical public health issue. The health issue is multifaceted and particularly complex to manage in terms of prevention and intervention. Elderly populations are amongst the most vulnerable people within our society due to the inevitable consequences of aging and later life, for example, health issues and loss of autonomy. Living in rural areas presents several challenges in terms of accessibility to services and family that exacerbate the complexities faced by elderly people in terms of mobility. Loneliness is a subjective, negative feeling related to a person's own experience of deficient social relations. This public health issue is a concern due to the substantial body of evidence linking loneliness to the onset of mental health issues, which becomes particularly problematic in later life. Loneliness not only impacts on the individual, but has ripple effects in the wider community, imposing considerable costs to a person's physical and mental health, leading to higher rates of mortality, particularly in rural areas. As the aging population is set to continue to rise over the coming decades, the issue will continue to impact more and more people as time goes on. The geographical challenges mean that rural towns are often left behind when it comes to access to reliable broadband services, transportation, and opportunities for social connection due to the outmigration for younger generations into the city in search of better opportunities. The combination of these three factors alone, with the large majority of elderly people lacking sound technology knowledge, continues to greatly impact on the sense of belonging and connectedness, which is key to lowering the risk of mortality due to loneliness-related factors. There have been a number of prevention strategies and programs that have been previously used to address the issue of loneliness in elderly populations in rural locations. The direct strategies implemented previously have included one-on-one interventions. These have included befriending programs, mentoring, and community navigator programs. Direct strategies have also included group services and wider community engagement. The indirect strategies that have previously been implemented to combat this public health issue have included public awareness and reducing the stigma surrounding the issue of loneliness. There has previously been a number of strategies within public health and allied health to assist in identifying and diagnosing health issues associated with loneliness and education for health professionals on this topic. As yet, there are no approaches that have a robust evidence base or measurable outcomes. When developing a large-scale public health strategy such as ours, the framework selected directly impacts the longevity and the success of the program. The program logic framework is predictive and prescriptive in nature, as opposed to descriptive and explanatory, as it aims to forecast potential challenges, providing opportunities to create proactive strategies in the event that these challenges do present themselves. This enables a methodological and holistic approach along with the needed structure to undertake all identifiable tasks without feeling overwhelmed. The framework's visual nature helps in linking outcomes to interventions through maps and clearly sets out expectations for all involved, as well as having built-in ongoing monitoring mechanisms to ensure the project leaders can drive the decisions and direction of the project accordingly should any issues arise along the way. This reduces the chances of reaching the end of the project only to discover previously unidentified and therefore unaddressed issues and challenges which would impact directly on the long-term success and longevity of this program. Disconnection is the common denominator for issues stemming from both living rurally and aging. Hash and Morrows suggest that the introduction of technology-based supports for elderly populations are effective in alleviating feelings of isolation by keeping them connected with family and friends. Technology can also be used to connect elderly people with healthcare services that may be inaccessible due to a lack of services in rural areas. Our group proposes a strategy built upon the implementation of technologies that aim to keep people in rural communities connected with key relationships and as a means for clinical professionals to monitor the health and well-being of elderly people living in rural communities. We propose that a case management system will be in place that involves monthly visits to the elderly population, and the first visit will include education technology. This strategy will set up the elderly people with regular video link calls to all family members and friends in the community. As a means of ongoing development, practitioners will chat with participants every week to check in and receive updates from the targeted group to ensure no issues in navigating the technology. After a period to adjust to the technology, service providers will introduce other applications to enable elderly populations to access telehealth services. Within public health, there are several values that underpin practices and the development of prevention strategies. The core values of public health are equity, social justice, sustainable development, and the health of the community and the individual, respect for diversity and self-determination, empowerment, and community participation. The proposed prevention strategy aligns with all of the core public health values. The prevention strategy is aimed at ensuring all the values are met through the promotion of online services and digital inclusion. This strategy aims to respect that elderly people in rural areas have previously been overlooked and undereducated within the digital world, and this has created a disconnect within their communities both socially and structurally and denied them access. By promoting the core values of public health, this strategy will be able to target those individuals that have previously been excluded, and the aim is to strengthen social capital and connectedness to promote health of the community and the individuals within it. Our prevention strategy carefully considers several social determinants of health which are often identified as contributing factors to loneliness in many older adults in rural areas of Australia. Firstly, at the macro level, their geographical location creates one of the main challenges to feeling a sense of belonging and social connectedness. With this in mind, access to vital services and infrastructures such as transport, adequate and reliable broadband connection, as well as the health and wellbeing services within their community impact greatly on the health outcomes for older adults. At the meso level, having opportunities available for regular social participation, whether with friends, social groups within the community, and feeling as though they are a valued member of their community, has been shown to contribute to loneliness when these opportunities are either not as available or if the individual feels disconnected from these even when they are greatly available. At the micro level, their personal, physical, and mental health, coping skills, and understanding of technology can all greatly contribute or impact on their capacity to access resources and to connect with their community and family. To assist the implementation of our strategy, our group proposes an approach that encompasses a whole community response to ensure positive outcomes for the elderly populations living in rural areas. First, local organisations and volunteers from the community will be asked to facilitate and monitor community focus groups. Community groups present as another opportunity to form connections within elderly rural communities. Within these groups, facilitators will work with the elderly to familiarise themselves with technology and further develop their skills. Health providers will also be involved from afar. The skills attained by the target group can then connect them to health services from which rural communities are often isolated. Due to the nature of living rurally, our group also proposes that as well as weekly contact from a case management perspective, external community services are utilised to ensure that the elderly population has regular personal contact. An example of this in the UK, where the annual loneliness report 2021 suggested using postal service workers to monitor vulnerable elderly populations was effective. Loneliness is a public health issue that is difficult to identify, diagnose, and measure, but is one of the largest growing public health concerns for the future. As our society becomes more technology focused and less personally interactive, there is the need to invest in programs that strengthen community connections and social capital. There is a need for greater research and development of ways to measure loneliness and positive intervention strategies and outcomes. As our elderly population grows, there is currently a gap in public health strategies that are targeted and implemented to ensure loneliness doesn't become an epidemic and negatively impact a large portion of our society.